I'm not sure anybody envisioned what it would take in a new millennium to have a sustainable, high-performing healthcare system, but I think it's becoming much more obvious today that the status quo is not going to get us there.
When I went into this environment, I thought I was just going to give some antibiotics and homeless people would get better, maybe treat some tuberculosis or some HIV. But then I recognized if I didn't treat their psychiatric problems, I couldn't treat their medical problems. But then I recognized I couldn't treat their psychiatric problems until I treated their addiction. And you can't do any of that unless you have a stable, housed environment with supporting services.
The future should not be centered around the hospital. When 10% of your patients are 50% of your costs, you need to pay attention. These were patients who could not be managed in the community in primary care, weren't sick enough for the hospital, but there was no place to go.
I have COPD. I was in the hospital and they were trying to keep me in the hospital. And I said, no, I didn't want to stay in the hospital. I get too claustrophobic and panicky. It's just like, no, I want to go home. I call this home.
All the organizations who have a mandate to address health needs for the homeless came together and they formed this new organization. If you look at other cities who don't have similar kinds of services, what you see is that there's very high rates of emergency room utilization, much higher rates of police interactions. What we have been able to demonstrate with every population that Inner City Health works with is that it costs less to intervene than not. It's pretty hard to argue against doing a better job and spending less money.
Now you could argue that, why should we bend over backwards for these marginalized populations? And other than compassion and a commitment to service, which I think are important Canadian values, but at the very least, I think you have to make the argument that this saves you money.
In the past, population health approach has really been divorced from other kinds of strategies. I think that that's rapidly changing and that we're recognizing that real change and real impact comes from marrying those two strategies together. And that's really how you'll affect the changes that you want to have.
The solution is not in the hospital, but it's not probably in any other silo that exists. It's something different, and it's something that we create by working together.